Okay, so I'm going to give an overview of the Early Care and Education Initiative as of April of 2022. It's in slide presentation format, but I do have it as a PDF, so I can also send it out to people afterwards. So I'm going to share my screen. And I will pause and just ask if there are questions since I can't see anybody just as I'm going here, because I'm sure if somebody has a question here, then it might be somebody who's watching this later might have a question. So I just started at the beginning of the initiative, how we started here with a planning committee at Vital Communities, which led to the symposium. Part one was problems from the perspective of employers, employees, center directors, and staff, with Upper Valley data and statewide policy information about the ECE crisis. And then the second part was focused on solutions from many perspectives. And then there was a breakout portion of the second symposium where people got a chance to say how they could be part of a solution, how them or their organization could, how you could contribute. And all of that information was taken by the planning committee, and they formed into a steering committee. A few more members were added. And from the information that was garnered from the symposium, there were 3 work groups created. One is focused on facilities and models, to identify and catalyze strategies to reduce operational costs for ECE providers. And then one is focused on workforce recruitment and retention. So engaging in a bi-state exchange of policies, advancing the goal. And then advocacy to, oh, I switched these, sorry. I'm gonna have to switch the content. So the workforce recruitment and retention is obviously to catalyze recruitment and retention of ECE staff, and the advocacy purpose is to engage in bi-state policy exchange. Participants in the steering committee are these folks from these organizations: Sara Jackson, myself, Sean Mulholland from the City of Lebanon, Brooke Couch-Freeland from the Couch Family Foundation, Sara Kobylensk, also from Couch, Rebecca Parton from the Dartmouth Trauma Interventions Research Center, Amy Brooks from the ECEA, Jen Parker, an ECE provider, Allison Chisholm, and Emily Tenenbaum from Let's Go Kids. Purpose of the steering committee is to basically solve the ECE crisis in the Upper Valley, to put it very concisely. We wanted to make sure there's a priority on infant and toddler care, on funding, and on research, both on what we know already works really well and some new things that might be available. And those innovations might come from outside the Upper Valley. They might come from, other parts of the country, other parts of the world, but we want to be open to that. So going through each of the work groups, the facilities and models work group participants, these are the folks who have most consistently attended. This isn't everybody who's ever attended. And actually, Celissa Hoyt is not going to be attending anymore because her work is really focused with CCA Global Partners at this point. Jackie is attending from SELA. So. And here are the goals and the current status of each goal. So we're looking at drafting a property tax exemption legislation. So Sean is working on that with somebody from the city of Leb. We're looking at our options around forming a childcare provider support services cooperative. We're going to be getting information from Jamie Stewart pretty soon, who is heading a similar similar project in another part of Vermont. The consumer cooperative. So for that piece, we're looking at, we're waiting on getting data back from the ECE provider survey so that we have an idea of what the needs are and what the true cost of care is. And then we'll be getting some consulting from Paul Deshane on the economics of a cooperative like that. Sean is also working on putting together a model template for municipalities to use on zoning regulations that would include licensed childcare facilities in new buildings. Public-private partnerships. So Sean is laying some pretty amazing groundwork with that in terms of, he's got a policy proposal for the New Hampshire Municipal Association. That's the NHMA right there. For that association across the state of New Hampshire to adopt the importance of childcare to the economy of New Hampshire, so that all municipalities have that as part of their goals that they always keep in mind when they're doing planning work. And Jamie Stewart will also be helping us with how we could include business literacy skills and support for childcare providers. It's sort of a shared, kind of back office functions model. This group, the staff recruitment and retention participants, again, not everybody who's ever attended, but and then recruitment and retention has these goals. So I just put the current status of each one. I will just say about this one, the goal around the retention goal around mental health supports for staff, that in speaking with the Upper Valley Childcare Committee, which is also, and some other leaders in the region that are focusing on, early childhood issues, that there's this larger need for mental health supports in childcare facilities and in other sectors. And we had this question of whether we wanted to tackle that or not for children. And I think that remains to be seen, but I think this, we should look at whether we're going to develop this more around the mental health supports for staff in terms of a retention issue. Because I think that the childhood piece is kind of being focused on in other areas or by other groups, who we could collaborate with, but. And then the advocacy group participants. And we did note when I presented this to the steering committee that the advocacy group in particular, I mean, all of the work groups need to be coordinated with one another, but the advocacy group in particular really benefits from input from the other groups so that they can be strategic about, what their advocacy efforts are. And that this mention of a legislative roundtable event, this was an idea that the group came up with, but it hasn't been articulated any more than that. So it hasn't been like formed into an actual goal yet, but. We're just looking at coordinating across the work groups. These are some of the questions that we're considering from the steering committee level, and that will help inform the work groups for their actions to be really coordinated with one another. Does anybody want me to go back to a slide or have questions, or should I stop sharing at this point? And
I think it'd be interesting to go back to our particular work groups slide, where you're talking about what we're actually doing and how's it going. Because I feel like you were really generous to us, and maybe I'm just feeling guilty, but I will just say that I feel like you were really generous to us around what we're actually doing. I think what we've done is source some of the issues. I don't feel like we have settled in on a real overarching action plan or where our real focus is. And so I was really grateful to see this. I felt really proud of us in the steering committee thing, but I also was like, yeah, we've identified that. Yes. Okay. The inventory of workforce development supports. Yes, we're working on that, but we still haven't kind of knitted this all together into what is our real overarching goal. I mean, these are all action items, but they're not a coherent picture, I don't think. And I think that was the conversation we were having before. And so I feel I'm very grateful to you for having consolidated it in this way. And maybe looking at this, we start to see there are some buckets of things that we're really, I mean, like researching and inventorying, we're educating ourselves. Then we've identified some of these things. Are we going to try to move forward on all fronts at the same time? Or are we going to say, this is something that should proceed first and this should something proceed second? So I don't know, maybe I'm jumping ahead to what you and Amy have already thought about as our next level of work, but this was helpful to me to understand why it feels so frantic, because this is a big, long list of things and they're not necessarily knitted together. And like some of the things that I think have been some of the more creative ideas, but they're bigger ideas, like Ruth's idea of how could we create a substitute pool that could be, you know, that's a really interesting workforce solution, or a bridge solution anyway, but that's a big think, right? Like that's not like we can put it on one little action item and go, okay, check, we'll give these people that. And maybe we would prioritize that and maybe we wouldn't, but that's where this feels like, to me, this is the next place we need to go, is that we've done a really good job of kind of muddling around in a good way, not in a negative way, but in a good way of kind of just eliciting things. I don't know how other people feel about it or what you and Amy think the next step for us to take is, but that's where I would sit.
I think that is exactly the kind of thinking this should be stimulating. And before I do anything else, I just want to note that that is what each of these work groups now have the opportunity to do with this information. And what I might do is just share this recording with all of the participants, just as a walkthrough along with the slides. And that I'm going to stop my share and stop the recording so that then we can work through what we want to do in this work group with that information. But I just wanted to make sure there weren't any questions about any of the overall things or any clarifying questions about the presentation in case there's something about it that could be helpful to somebody else watching later.
One of the questions that came up, I think, in the steering committee was that people may have a question looking at this video, that the steering committee members that sit on any of those subcommittees are not listed.
Thank
So
you.
you may
Yeah.
see people at a meeting that aren't listed. If they're on the steering committee, they're not listed on the subcommittee. I think that's the only
Yes.
thing.
Thank you. Yeah.